Thank you, Laura, for adding that important set of issues to this discussion. We're going to turn now to Samraa Luqman. She is a Yemeni American from the southeastern area of Dearborn, commonly known as the South End, born to Dr. Wijin Luqman, a Korean War Army veteran who served as the chief of medicine in the Department of Veteran Affairs until his death, and Samraa al-Sbahi, one of the first female Yemeni American activists in her community. Luqman's first job was as a volunteer at the Lake City VA Medical Center at the age of 12, followed by tutoring with the Arab Community Center for Economic and Social Services. She went to work in the public schools while completing her bachelor's in psychology at the University of Michigan, and now works in social services with the federal government. In her 20s, Luqman became a board member and secretary of the American Yemeni Women's Association. It was around this time she noticed a multitude of community members becoming ill with cancers, asthma, and other illnesses attributable to pollution, and became more specifically involved in environmental injustice, speaking at community meetings and town halls. In 2019, she joined the Environmental Health Research to Action Steering Committee, which educates high schoolers about the impacts of pollution, and the PFAS Alliance shortly thereafter. By 2020, she also joined the Clean Air Council and presented to multiple audiences the effects and existence of PFAS in both our air and waters. Luqman's latest affiliations are with Concerned Residents for South Dearborn. She's also worked with the University of Michigan's Environmental Interpretive Center and Friends of the Rouge to raise awareness of the environmental issues of the South End. Her most recent endeavors include providing input on the enactment and enforcement of a fugitive air dust ordinance, fighting for cumulative health impact studies, and partnering with organizations, universities, and other entities to add green space, trees, and rain gardens to the area. I'm pleased to welcome Samraa Luqman.
Thank you. So I want to start by introducing my community to the rest of the nation. The South End of Dearborn is a community that was historically built by basically Ford Motor Company. When you hear the terms Detroit is the Motor City, what they're really talking about is the South End of Dearborn, where Ford's company or Ford's factory that builds the #1 car in the nation, the F-150, is located right here. Historically, since the beginning, there was a deep surge or need for cheap labor. And as a result, the South End of Dearborn became kind of a landing mat and a hub of of different immigrants coming to the nation in search of the American dream, and then filling the need that was through the Ford Motor Company for like the assembly plants and whatnot. As such, it continued to become that way, and as wars in the Middle East started coming up in the 80s or 70s, 80s, and then 90s, more people from the Middle East came to this area. And so now it's an ethnic enclave of mostly Yemeni Americans. Because of this, there is the demographics of the area are one of people who don't speak the language. I think about 40% of people don't speak the English language or speak limited English language. A lot of these people are low income. You have almost 60% that are on some kind of food or government assistance. They're also about like close to 70% of people that live here are renters. So you don't have many homeowners, or the people that did buy a home here have left, and for good reason, because there is a high amount of contamination of different pollutants in this area. Ford Motor Company is not the only plant that is here. You have 3 steel mills. You have a wastewater treatment plant. The Marathon oil refinery is just a few thousand feet away. And there's a total of about 42 major and minor source pollutants or polluters in the area. One of the things that was discovered of late was that there, in addition to the poor air quality, there's also a large amount of PFAS contamination. As of the last 2 years, the area has been added to Michigan's PFAS Action Response Team website as a contaminated site. And it began about 2 years ago when people were just driving down the freeway during one of our rainy days, and a huge blob of essentially white foam just came pouring out onto the freeway. And that's when they started basically investigating where PFAS was coming from. So when we talk about this exposure to PFAS, it's not just that we're talking about the exposure that's coming from the water as well. One of my passions is air quality. And so we look at PFAS going into our waterways, but we also know that it can be released in like smokestack emissions from industries using the chemicals. It could be passed into the air with when it evaporates. So there's lesser known exposures as well, like breast milk and breathing. All of these different types of exposure are basically present in this area, and they are going into people unknowingly. It's to the point where PFAS, we all know it doesn't disintegrate, it doesn't go away, it stays there for years, and it's been found as far as in the Arctic and polar bears, from the fish they eat and whatnot. So with regards to that, the exposure leads to these health effects that include cancer and asthma, COPD, and all these different types of health, negative health impacts. And the question becomes for our community, having been a community that's been labeled by the EPA as the 13th worst community as far as air quality is concerned. When you or your family member are diagnosed with X and Y illness, how do you know where that came from? Or if you have a child, in our area, we have 3 to 4 times the higher asthma rates than anywhere in the state. How do you know it came from the air quality versus PFAS? We also have high lead in our blood levels in our children at a higher rate. And it causes neurobehavioral issues, which we also know is something that is caused by PFAS contamination. So is this coming from PFAS? Is this coming from the air quality? That is one of the bigger questions we have. So testing for a child who has, let's say, high blood levels, if you test for them to see if they have PFAS contamination in their bloodstream, you'd kind of be able to know how to treat it. And one of the things that's important in treating somebody that's ill or any disease is that you have to know what is the causal factor. And so we need to have some kind of PFAS testing for a community that is living near an area of contamination. Additionally, as I was kind of hinting at, in my community, when you talk about any sort of contamination or any one pollutant, you have to talk about cumulative health impacts. So, we are working on it as activists from one side to try to pressure the state to do more as far as cumulative health impact studies. But at the same time, from the medical perspective, you have to know all the different things that are causing X, Y, and Z, like I said, to treat it. Some of the other effects that we're finding with PFAS contamination and other polluting in our area is like the ramifications is that the suppressed immune system, it's really shown how vulnerable we are with this new pandemic that's hit. It's shown that in our area, we have a higher susceptibility to mortality due to COVID than other people. This is already in a high-risk community. We're already unaware of the risks that you take by moving into this area. So not knowing that there is also PFAS here, somebody who, would say, I'll relax on wearing a mask. They don't know that, they can't do the same thing that somebody who lives 10 miles down the road can do of, forgetting to wear a mask, because they are more susceptible. So this community having been a large number of it, a percentage of it, a population of it, it's come from a third world country, specifically Yemen mostly, where there's already a war and there's famine and a cholera outbreak. They come here for a better way of life. And instead they're kind of condemned to, long-lasting health, disease, and suffering. And so there is a need for people to know what's going on, to know that there is contamination here. And it does unfortunately fall on some of either, the DHHS, the Department of Health and Human Services, the state's environmental department, or in this case, medical experts, to know about what contamination is in their patient's area, and advise them or let them know. One of the things that's it's really frightening is one of my neighbors has moved out of this area about when he was probably around 20 years old, and now near 40, he's having to deal with cancer. And one of the things that his doctor told him is that, just because you've left this area, because you've lived there for a certain amount of time, your body's already taken in all those carcinogens, and those don't go away even when you leave. So that one of the things that I feel is necessary is that medical experts have to know that their patients are coming from an area of contamination, and it is very important that they proactively reach out and let their patients know what they're facing and where they're living, how it's going to be causing them lifelong susceptibility issues, right up front. The other thing, as I was talking about, is differentiating, as I was talking about cumulative health impacts, is differentiating between the causality of the diseases linked to PFAS, and what other causal factors or contributory factors are causing the disease or illness that a patient or person exhibits. Is it hereditary? Is it due to other pollutants? For example, like I said, the neurobehavioral issues. In places where, those cumulative health impacts are not taken into account, or you don't know the multiple contaminants in the air and water, it's hard to pinpoint.
Excuse me, Samraa, you're running out of time.
Okay, yeah, okay, I'll just wrap up in the last 30 seconds. Okay, so the language barrier and the public noticing or education and awareness is probably also the most important thing. Just how to educate people in their own language, and making sure that they're advised and know about what's in their area going forward is probably most important as well.